So, good morning, Chitra. How are you?
Yeah, good morning. I'm good. How are you?
Absolutely fit and fine, really. Thank you for asking. So, could you just introduce yourself and tell us what you do?
Sure. I'm Chitra Lele. I recently started, not so recently though, about 18 to 20 months ago, I started this company called Actu-Real that you see the name on the background. Um, This was towards late 2020. I'll talk a little bit about what my current company does, but just by way of my introduction. Prior to this, I was part of the founding team of a company called Sci-Formix, which we started in year 2007. Um, so in addition to the focus on clinical development, etc., we had a pretty large focus on pharmacovigilance or drug safety in that previous company. It was acquired by Covance LabCorp, uh, and then I stayed back for a couple of years for the integration to be completed. After which I left to start this company. Prior to Cyformix, I spent about 10 years with Pfizer as part of their global R&D division. And my primary task was to set up their captive group in India to support their global trials in areas of data management, stat, programming, medical writing, etc. And Pfizer was the first company to do something like this, to set up their own captive unit to provide these services. So I was fortunate to kind of, be a trailblazer because of Pfizer, and was the first one to start something like this in India. We grew that group quite a bit, and then later on, I started, or rather co-founded Cyformix. Prior to Pfizer, I've done other things. I was primarily in academics and semi-academics prior to joining the industry with Pfizer, and I taught in universities both in the US and in India. I was teaching at University of Minnesota in the US. I was teaching at IIT Mumbai and Pune University in India. I was working as a biostatistician in cancer epidemiology in Stanford Medical Hospital and UC San Francisco Medical Hospital. And by qualifications, I've done my PhD in statistics. I studied at Stanford University in the US. And I've also done my actuarial science. I've written exams of the Society of Actuaries. So that's briefly my introduction.
Great, sounds really perfect, and that it actually delivers that you have contributed so far. But how do you think you have contributed to the health industry?
Yeah. So as I mentioned before, my first foray into the corporate world, into the health industry per se, was through Pfizer. And fortunately, because Pfizer was a trailblazer and I was able to, be with them that time. So I was responsible for setting up this captive group for Pfizer in India at a time when clinical trials, were not really, people did not really know much about clinical trials in India. And overall, globally, pharma industry wasn't really offshoring this kind of work almost at all. As I said, Pfizer was the first company to think about it. They thought about it in the context of data entry because there was so much software related offshoring, that had started. So they thought, why can't we get data entry done from India? And that was the original idea. But then they decided to follow through, and we started this group. So it was extremely challenging because the infrastructure and the ecosystem was not ready. The skill set was not available. So we had to do a lot of work, ground up in terms of just capacity building, capability building. So there were lots of initiatives that we had to take, partner with universities, so sort of just do that training, build that capability. So all of this was a first for India. And in fact, anywhere, because India was the first country where this offshoring happened. And the nice thing is, looking back, I feel that this was a good opportunity because I was in a way responsible for the way the industry shaped subsequently, the whole outsourcing, offshoring of data related activities for clinical trials. After Pfizer did this, many other pharma companies, large pharma companies, started doing similar things, first in India, and then, Pfizer as well as other pharma companies then spread to other geographies as well, such as China and then Eastern Europe. Then large CROs started doing the same thing. So, somewhere I feel that, I was responsible. I contributed to, this whole change that happened in the way, pharma companies sourced all these data related activities for their global clinical trials. As well, for building that infrastructure and that capability in India.
That sounds interesting and challenging at the same time, but I'm really sending my best wishes to you for the future opportunities and the endeavors that you get. May God, may you do best in the near future. And how do you feel about winning this award?
Oh, this was great. I had heard about this award, and I had seen the kind of honorees from the past. So it was nice to be part of that group, belong to that group. So thank you very much. Yeah,
I really appreciate it. Lastly, but not the least, how we can contact you, we can find your contact details and etc.
So I guess the best way is LinkedIn. I usually check it, at least once a day, if not more. So that also gives my personal ID, etc. But I mean, should I provide my email ID?
Yeah, that will be very helpful because you just mentioned you are very quickly active on LinkedIn. So for the audience, it will be very great opportunity to get in touch with you via LinkedIn. So you just mention your LinkedIn profile as well.
Yeah. So my LinkedIn is just Chitra Lele, and my official email ID is chitra.lele@actu-real.com, the name that you see here. And, yeah.
Thank you so much for letting us know all the information, and really wish to see you soon and wish you best of luck for the future opportunities. Good luck. Bye-bye.
Yeah. Thank you. Yeah. Bye.